Hi everybody, it's Adam with HeartValveSurgery.com. We're coming to you from the Heart Valve Society Conference in Abu Dhabi. I'm thrilled to be here with Dr. Marty Leon, who's the professor of medicine at Columbia University Medical Center in New York City. Dr. Leon, thanks for being with me today.
It's great to be here, Adam. The weather is much better in Abu Dhabi than it is in New York right now.
I bet it is. So let's continue these questions we've been answering. All right, the
Sure.
patients have been submitting them from all over the world. They want to know a lot about one of your specialties, transcatheter aortic valve, TAVR. And this question comes in from Nancy, and she writes, "Hi Adam, I have severe aortic stenosis. It was suggested that I have a TAVR inserted through an artery under my collarbone. What exactly does that entail, and what are the risks and benefits? I am 68 and I have a large body size, so other options were ruled out."
Well, that's a very, very interesting question. Most of the time when we choose to do TAVR, we do it from a small nick or a puncture wound in the femoral artery, which is in the groin area. And I would say that close to 95% of patients have the kind of anatomy that is amenable to that approach, and the results have been wonderful with that approach. But there is that 5% of patients who are not good candidates for introducing the catheters and the valve from the femoral artery, where we have to look at other alternatives. The most commonly other alternative has been this under the collarbone, we call it axillary approach, which is the artery that sits close to the shoulder, and that's where we enter. And that's become highly successful and is the preferred approach by most of the TAVR operators in the world. I will say that it requires some special expertise. I would make certain that your operating team has familiarity with this approach. It can be done one of two ways, with a small incision to expose the artery, or done through the skin, just with a puncture wound, which most people now feel may be the preferred approach. Otherwise, the TAVR procedure is identical. The complication rate seems to be about the same, so I don't think there are any greater risks, but it does allow us to stay out of the chest wall as we insert the device. And it does provide a very acceptable alternative to the transfemoral approach in those patients that are not good candidates.
Well, so thank you for the answer. I hope that helped you, Nancy. I am guessing, Dr. Leon, because I am relatively naive when it comes to all things medical, but she brings up the access by collarbone. We know about the femoral entry point. Are there other ways that TAVR is implanted?
We have been incredibly creative about how to find ways to get these catheters to the heart. There is an approach where you can go into the carotid artery, which is above the collarbone, not underneath, and next to the jugular vein. That's another approach. There is what we call a Supra sternal approach, which is right above the breastbone, going in this way, and that requires some special surgical expertise. There's an approach called the transcaval approach, which means bringing the device from the inferior vena cava, which is a large vein, and going from the vein to the artery, and then coming around and inserting it. So there are a variety of creative ways of being able to do this, but as we just said, I do think that the transaxillary approach is probably preferred.
Great. Well, again, I hope that helps everybody out there understand that there are multiple access points for TAVR, and I hope that helps you with your question, Nancy. So thanks again, as we always say here, keep